Welcome to the Global Public Health Revolution, the podcast by the AIDS Healthcare Foundation, where global public health meets bold advocacy and game-changing marketing to spark real change. Welcome to the Global Public Health Revolution podcast. And on today's episode, we are switching gears a bit to look at the creative side of health. But before we go into it, I just want to say thank you to all the listeners and those who have sent us feedback and comment. We do appreciate you for listening and following the conversation. And please don't forget to share with your peers, your network, and of course, your loved ones as well. So like I was saying in the beginning, we're looking at the creative side of health. And in today's episode, Safer is Sexy, we'll explore how creative campaigns and bold marketing make health awareness not just relevant, but fun, aspirational, and even cool. Joining me for this episode is Jason Farmer, the VP of Marketing at the AIDS Healthcare Foundation, and Dr. Sam Prasad, the Country Program Director of AHF India Cares. They will both share their insights on what it really takes to design campaigns that stick, break stigma, and drive real behavior change. Welcome to the podcast, Dr. Sam and Jason. It's good to have you on.
Thank you so much.
Thank you for having me.
Great. So we've talked about a lot of topics we've explored on this podcast. Have looked at, for example, youth health, men's health. We've also looked at just the global state of health as we know it right now, or even the role of civil society. And today we want to talk about the creative side, because that's something that we see is not as much as it used to be back in the day on a lot of issues, for example, HIV, right? But before we dive in, I just wanted our audience, our listeners, to get to know you both a little bit more. So if we could start with you, Dr. Sam, what is it that inspires you? And, just tell us a bit about yourself.
Sure. I'm Dr. Sam. I work in AIDS Healthcare Foundation as a country program director for India, and I'm based out of New Delhi. Primarily a physician, but at the same time, got interested in public health, and then, switched gears into public health, worked with organizations like UNICEF, WHO, and finally landed at the right place, I should say, because this is where, the liberty to kind of, work with fun and with, campaigns and all this, that's so very exciting for me. And then, as we go forward, Kemi, I'm sure that, we'll be able to kind of share some of the things that we do in India. India being a country which is very orthodox, it was very difficult at the moment. I mean, at the start, but now we have gone ahead and then kind of grasped it with all our energy, and fun element of it is now the in thing with marketing for health. So thank you so much, Kemi, for this.
Thank you. We're looking forward to hearing everything. That's why we have you on. Jason.
Hello. Hi, my name's Jason Farmer. I'm the Vice President of Marketing for AIDS Healthcare Foundation. I've been with AIDS Healthcare Foundation for over 20 years. So the very beginning of our healthcare marketing and the way that we've pursued it now, I was there at the start. So it's been a lot that we've learned over the decades, and we've hopefully helped perfect and determine the best way to give out our message. So look forward to discussing that more today.
Thank you, Jason, for coming. You're coming with a wealth of experience, and that's really good. So when we mesh that with Dr. Sam and India, you see, that's the beautiful thing about this podcast, is bringing diverse perspectives and context to actually drive home public health messaging or public health initiatives. So now that we've gotten the introductions out of the way, let's go into the business of the day. And we'll start with you, Jason. So you are the Vice President of Marketing. So you are a creative genius, if I'm allowed to say that. Now,
I'm not going to stop you, Kemi.
So, because I think a lot of people, for those who know you within the organization, they know you as a creative. And then those who don't know you outside of AHF, I think this is a good opportunity. And I'm sure someone is wondering, what is it like in the day of a creative person, especially for someone like you who is a vice president of marketing? What's your typical day like?
Yeah, well, the typical day is that there is no typical day. Just in the fact that we are always every day's a new challenge. Every day's something new that we're trying to get out there and affect people. So within our marketing department at AHF, specifically within our domestic marketing that I work, but even more broadly in our global marketing, we're very similar to an ad agency. So many for-profit companies, they have an ad agency that either works within their or their company, or as an outside agency that they would work with. So with AHF, we took a very different path than most nonprofits, and we used to work with marketing agencies outside, but we just felt that they weren't really getting our message across the way that we wanted to express ourselves. And a lot of the advertising and the videos and those things that we do to reach the public. So the president of our organization, Michael Weinstein, had this just wonderful idea that we should bring that this agency aesthetic and idea into AHF so we could design our own messaging. And so roughly about, I would say that was probably about 15 plus years ago that we started doing that. And now at this point, we've reached the rest of the world. So we have campaigns that we develop here, or we develop in our global division that cross-pollinate. So sometimes we'll have those campaigns that will be here in the US, and sometimes vice versa. And these are campaigns that address not only HIV and AIDS, but also other STDs, sexual health, sexual education. So at this point, it's just been great to see the amount of, I guess, we've become very famous with a lot of the things that we do, and people tend to know AHF based off of a lot of the ad campaigns in certain places. So that's been very, very good to feel, after doing this for so long, that AHF has become kind of a household name in a way for the way that we approach our sexual health messaging.
Yeah, thank you for sharing that, because I am on Reddit. And so every now and then I see someone put up an AHF billboard on Reddit, and it sparks a whole lot of conversation, right? Which is a good thing. And that's the benefit of it, is to get people talking, but it's to also get them to be conscious and very aware of their health. Now, you've created some iconic messaging campaigns for AHF. So I think of Just Use It, which is also one of my favorites. And you talked about when from the US gets pollinated to global. I think of the cheated on campaign. And I know how that, for example, in a place like Uganda, sparked a lot of conversation. But people were talking about, we need to talk about this thing. So I want to find out from you, before you start conceptualizing a campaign, the visual, the messaging, the tone, the style, what goes through your mind as a creative?
Well, I guess it really would depend upon what message we're trying to get out there. So the way that I like to approach it now, when we're talking about specifically building advertising campaigns, and usually I'll just look at research. So I'll look at current things that are happening in sexual health. Here in the States with the CDC, a lot of the reports that they'll put out, they'll have information on what STDs have increased in rates, who the demographics are that are most affected, the communities that are most affected. So I try to take a lot of that data and really determine how we can make a sexual health message out of that, and an ad campaign about it to express, for instance, we have done campaigns about gonorrhea and syphilis here in the States. And a lot of the reason why those get attention is because those are taboo subjects still,
Yes.
for the most part. So what we do is we try to take that and make it less taboo. And we tend to use outdoor advertising like billboards and things like that out in the public. And just with a very simple message, we'll usually keep it with 3 or 4 words as a tagline. And just pose it to the viewer, like about, we had one of those gonorrhea alerts. So it was about drug-resistant gonorrhea that resistant to antibiotics. So those type of messages are things like people don't tend to think about normally. And so it gets them talking, and that's why it ends up on social media and things like Reddit, where it is very popular. And sometimes we just have fun with it, and that will get attention too, because people aren't used to seeing those sexual subjects on billboards out. So
Yes, I hear you say keep it sweet, keep it short, keep it punchy, and sometimes just have fun with it. But you also raised the issue of taboo topics. And so I want to go to Dr. Sam, because one of the topics sometimes that could be a taboo is condoms. And beyond just how condoms are perceived, condoms actually are very effective, cost effective, but also efficient in terms of the role that it plays in prevention, in health protection generally. It has the capacity to prevent HIV, STIs, unplanned pregnancies, give people control over protecting themselves and their loved ones. But yet what we're seeing now is that condom use is declining. But there's also like a waning in interest on condoms. It's almost like there's an apathy towards it. People don't think they need to use condoms. So Dr. Sam, from your experience as a medical doctor, why is it vital for us, not just on the creative side, but now even sustained investment on condoms as a critical prevention tool? Why should we continue to advocate for that?
I think, Kemi, you have already stated it. Like, this is the most effective, cost-effective, and one of the most cheapest prevention tools that are available for mankind, as an entire population. At the same time, if you look at it, traditionally, it has been so very much stigmatized that, a person going to buy a condom has to kind of go there and do gestures and signages, and then we call it as the pharmacy or the medical store here. He has to wrap it around. He say, okay, give the payment, and then he has to put it. Like very very subtle, very kind of moves that people were very indifferent. So from there to make a very traditional Orthodox community to come out is actually our mission. Like how making it fun, short and sweet, but at the same time, sometimes we might have to fight the dogmas and the stereotypes. And that's the best example for India. In terms of looking at a solution for condoms in India. This came out as a step out of an MTA report, which is a midterm assessment report of National AIDS Control Organization, when we saw that 13% of uptake was only there for an entire year of all that was projected or to be distributed. What is that? I mean, is it bad planning? Is it bad logistics? What is it? So, the uptake, to increase the uptake, we studied the pattern, and we found that stigma associated to condom was a major issue. So, identities. If a woman wants to space a pregnancy or, have safe sex, cannot go to a store. Even today, as we speak, it's very difficult for rural community women to come, or women to go there and get a condom in India. And that's a sad reality. What we came out, as Jason was always talking about, creative ideas, we wanted to kind of, look at a model called a free online condom store. Okay. So free online condom store. How do you do it? You just have to type a mail, or sometimes, there are not people who are educated to go, on an email to kind of put a request. There is a toll-free number that we found, and then we launched it with 1 million condoms, just like that. In fact, Terry Ford, who is our global chief for advocacy, she was the one who came and launched it. In 60 days, Kemi and Jason, you wouldn't believe, all the 1 million condoms are over. 60 days. So it is, and if you look at the map of India, where we have served is almost all the states, locations, let it be rural communities or even urban communities. So what we need to understand, maybe through that, and we learned it with our own experience, is that if you can address stigma, condoms will be there. So stigmatizing or destigmatizing condoms is a way to kind of go forward, is one of the lessons that we found, and that's a way to, look at how we can channelize it. We have several other models, but I'll stop with it right now.
I know, Dr. Sam. I know you have a lot that you want to share, but I like the idea of the free online condom, because it's basically making it very accessible. And that you raise a very important point of how condoms are stigmatized. And I just want to let you know that even from where I'm from, which is Nigeria, it's not just women who are hesitant sometimes to go into a pharmacy. Even men feel like they'll be shamed if they go into a pharmacy to ask for condoms, right? So it's making it cool. I would say making it cool, making it sexy, making it the norm to say it's okay to walk in and get condoms or to access condoms. So one is bringing it to the people with the free online condoms like you're doing, but the issue of stigma. And I think there's a role that creative marketing can play in helping to destigmatize that. So, Jason, let me come back to you to say, how can we revolutionize condom messaging so that it's fun, it's normal, without shame and guilt?
Yeah, well, I mean, that's a great point. What Dr. Sam was saying about, with condoms, with the amount of stigma that comes with them, what we, or at least, when I try to think about these things, I try to attach the condom to just sexuality and sex being fun. That's a universal thing. Is we can't look at sex as being something that's shameful. That's why it's hard for people to go and ask for condoms, because the taboo and the stigma around sexuality. So, whenever we're creating these campaigns, we want to attach the idea of the condom, which is just really just a piece of latex. We want to attach that to all the positive things in sexuality, because it can also help prevent things that will impact your life, sometimes in very negative ways. So by attaching those two things together, it kind of gives a more positive approach to sexuality.
Yeah, I agree. Dr. Sam, just piggybacking off Jason, you do have some creative stuff that you've done to get condoms to be fun. So maybe you want to share that with us. I think for our listeners, it would be very helpful. What drives your creativity on how you get condoms close to people?
Sure. I mean, I think, Jason, thanks to you. But then, as we did this, you can see
the condom mascots.
Yeah, the condom mascot. But at the same time, this we attached, and there is a condom here, if you can see that, right? So yeah. So this became a mascot, Kemi, when we dealt with the youth population in the colleges, in the schools. Initially, when we approached the principals or the headmasters or headmasters of the schools, they were saying, everything is good, Sam, but don't bring the condom inside. You know what? We said, okay, let's not even bring the banana and the condom, but let's go with this one, okay? Initially, right? And then they didn't have a problem having to dance and then sing a song or, maybe a dance to one of the condom anthems that we put it out during our International Condom Day on February 13th. So the students were so excited that they used this prop to kind of dance, do a flash mob, things like that. So, immediately they were attracted. And again, this reduced the stigma. This is just a doll. I mean, as you can see, but of course, the message is very strong that here, right? So that way, destigmatizing. Again, Jason, thanks for your great idea about this, piggybacking on the idea of just use it,
Just use it.
Just use it is a great one. Likewise, we did some of the other things that we do is like, for example, this is a jacket, right? But it says something here. It says the Condom Love Brigade.
Oh, Love Brigade.
The Love Brigade. Okay. Right. So this is there's a little bit of history to that, Jason, if I may, and Kemi, if I may. So there is a state called the Mizoram, the state of Mizoram, which has 2.8% prevalence. The country prevalence is 0.20, so it is like almost 200 plus times of HIV prevalence. And predominantly in a country like India, where most population, above 80% are Hindus, this one state happens to be more than 90% Christians. So, and three churches like Catholic and, Presbyterian and all that. And when we went and met, when we saw the reports, it is coming as 2.8, very high prevalence. And then we met the health minister. The health minister said, Sam, everything is okay, but don't talk about condoms. You know what we did, Kemi?
What?
We went with a 40 feet inflatable condom on the That's why I said, sometimes you have to challenge the dogmas and stereotypes. And what I did is, like, I put it out on the main road, and then made signature campaigns with that. All the press and everybody is like, what is happening in Mizoram with condoms? And then I called the minister and said, sir, now is the time for you to come and own up the program. Everybody is so excited that you have brought this. No, I didn't bring it. So no, that they don't know, but you can own up the program right now. So that is, infusing that idea into him.
Yeah.
So from there, what we did is there is bike taxis, motorbikes and motorcycle taxis there because it's there hillocks, basically small place. The bike taxi drivers were collectivized and they said, can you partner with us for, distribution of condoms? They said, we will be very happy. We gave them these jackets, and on the back of the jacket, you see a pouch here. So this pouch can be opened and then condoms are filled in here. And you can see Love Condoms are branded condoms here. So the idea was that, whenever somebody comes and hitches a ride or, takes them for a ride, they don't say anything. They just say, I'm part of a campaign. That's why, So there is something that is free for distribution. If you like it, please take it. And this is a huge hit, Kemi and Jason. And all these, these jackets are still in demand. Even now, people come and say, the drivers, the motorbike taxi drivers association, they come back and say, sir, this is a hit program. We want to be part of it. There are women drivers also. They say, I'm okay with that. Somebody is driving with me. I don't ask his or her address, but I let them have condoms. So again, destigmatizing at the same time, bringing access to people.
Yeah, who doesn't want to be part of the Love Brigade? I want to be part. Sign me up. I want to be part of the Love Brigade because, and just for the benefit of our listeners, the Love condom is actually an AHF branded condom. AHF also has the Icon gold condom as well. So it's good that you're using, because that's why we're having this conversation. How can we revolutionize how health awareness or condom awareness is done? Because most times people don't want to go to get condoms, or they can't even find it, so, and it's addressing the cultural taboos, the religious taboos around it. But my question before I go to Jason is, Dr. Sam, so how do you get buy-in from religious leaders? Like you were mentioning that there were a number of churches. How do you get them to see the reason behind this? That it's not to promote promiscuity or anything. It's more preventive, and it's important.
Yeah, I think, Kemi, that is the greatest challenge of working in a state like Mizoram in India, where the church actually is more powerful than even a political party. But what we tapped is we got the most active young priests to come for a meeting, and then we talked about, your mission is to kind of, bring people to the church and, administer the church, etc., etc. But your church members, how many of them are actually going, in this, epidemic or in this, HIV scourge? And then there is an opportunity for you to kind of, bring them back. So we started small conversations like that. And then the youth associations, we started talking to them saying that, of course, you are such a, vibrant community. They are into music and football and things like that. So we started giving, associating for their Northeast football tournaments, Northeast singing. There is a lot of singing competitions, music festival as they call it. So we collectivized them there, and then we started giving them those kind of trainings, and the youth picked up. And the youth motivated these pastors and this priest to kind of, bring it as slow. There were a lot of apprehensions in the initial days, but then slowly the youth were able to come on, say that, we would definitely love to take it forward, So that way, we infused it through the youth only. And then the church, finally, we had a training for the clergy. So it is a very slow approach, Kemi and Jason. It's not easy. But as we go each step of the mile, we were advancing our, mission of, protecting this state from not having further infections, and also infuse the idea safer is sexy in the minds of the young population. So that is how we slowly are progressing. Even now, this is a mission for, it's a focus state for AHF in India.
Great. I like the idea of the use of the bike men as well, or bike women. Some people call them Boda Boda, depending on where you are on the planet. And they go very far because they go different points. And when they wear these reflector jackets with messaging on them, it also forces people to ask questions when they pick up passengers. So I like the idea.
Kemi, this is the attachment to that also again. If you can see, I don't know whether I'm showing it the right. So this is like, you just
You have a lot of Love Brigade tools.
this goes on the taxi, the car taxi, as a chair back. This is on the seat, on the headrest of the driver, and this is what happens. So here is a pouch for condoms. Here is a pouch for IEC. Here is some, maybe some condoms, free condoms are here. Maybe other things are here, keychains and props, where we attract them. Basically like that. And then, this is also kept inside taxi cars. So it's not only the bike jackets, but also the cars, the Taxi Drivers Association, and this is the government buy-in. So it's very important, It's just not the Taxi Drivers Association, but the government has to buy in our concept. So another way of providing access,
Thank you, Dr. Sam. Jason, do you want to add to that? Please go ahead.
Oh, no, I just think that's getting back to what we were talking about with confidentiality, too, in a way. That's a way for people to get condoms without having to directly ask a person for it. If it's right there in front of them, they can discreetly grab and go. That's awesome, Dr. Sam.
Absolutely. So let's look now at what is it that makes people pay attention to a campaign? Because for some people, they say it's humor. Some say it's the shock value. And some say storytelling. But we've also seen cases where people say, oh, no, the shock value doesn't work anymore. We need to find something else. Jason, what would you say about that? What do you think people pay attention to?
I think shock value still is something that can attract attention. I think it's more of shame that people are tired of seeing. They don't want to feel shameful about being sexual. And also they don't want to feel shame about STDs because unfortunately STDs are part of our lives, and people shouldn't feel shame or that they made a mistake or there's something wrong with them because that happens. So the way that we want to look at it whenever we're putting campaigns out is we want to be able to walk that line of being able to have fun with the message, possibly shock people if we're talking about things like increased rates, or like I said before, with the drug resistant type of gonorrhea, or like ocular syphilis. We did a campaign about that. So which syphilis that affects your eyes. So when people see that, they might not be aware that those things exist. But we want to take away the stigma and not try to scare people, but just try to get them interested and to have them go and do their own research and find out what this really is about. So we just want to kind of push people in the right direction without being too pushy or being judgmental.
Thank you for sharing that. So when I think of the STDs are timeless ad, one of the things so that's an AHF ad, and it had like elderly people, and a conversation that it sparked from from some of the countries. It's the fact that we don't think that elderly people have sex. We don't think that, but that was very timely. And the good thing, I think for me, shock value, I agree with you when you say shock value still has its relevance, because the first time I saw that billboard, it's feeling like, okay, now we're looking at the older demographic. And, for some of our cultures, it's something you don't talk about. You don't talk about sex, but to say that, the image itself is loving, is endearing, but it's also to say you also need to be careful as well, because STDs are timeless. I think messages like that are very powerful. They remind us of things that we sometimes forget, just like you talked about the ocular syphilis. We sometimes don't think of those things or remember them. But then when we see an image that jolts us, but in a way it's not judgmental, it's endearing, it forces us to think about it and talk about it as well. So, yeah, I agree. I like that STDs are timeless. I wanted to be a fly on the wall in maybe some groups where you had elderly people
Oh
to see
yeah,
what they thought.
yeah. It definitely got a lot of attention, especially on Reddit. Because just when you have a older couple on a billboard and you're talking about STDs and they're kissing each other, that's going to draw a lot of attention. So there were a lot of people on Reddit talking about grandma and grandpa still getting it on was a lot of
Exactly.
things people were saying. So, but it's something that we do need to address because that is a community that is having sex, and STDs are a big issue right now. The numbers are insane if you look at them on how much that's popping up in retirement communities, and it's just the
Yeah.
fact that people are living longer and they're still sexual, but unfortunately don't think they need to use a condom because they're not worried about pregnancy. But
Yeah.
STDs are still an issue, so that's why we wanted to address that.
Thank you very much. That's very, very powerful. How do we cut through the noise in this era of endless content to make sure that health awareness campaigns or messages actually stick?
I think we've discussed a big part of that too, and that's being creative and not shameful in the way that we get our message out there. Really trying to attach ourselves to new media and looking at our audiences, the people that we really want to get through. To right now we're just seeing who's most affected is younger people. So over half of the new STI infections in the States are people, younger people, 15 to 24, I believe, or around there. So in order for us to do that, we have to look at things that are popular, pop culture type of references that we can attach to that will make people laugh, but also think about what the subject matter is. So we've had a lot of success in the past doing that with what we call parodies here in the States of film or TV or pop culture references and things like that really helps too. But also utilizing things like TikTok and influencers and people that could speak on subjects, and also giving accessibility to our wonderful elite doctors that we have and our medical officers that can speak to the subject, and we can deliver that message to people a lot of times with them not even having to approach us. And also making it accessible for people to get information that they need about sexual health, like with our websites, with our freestdcheck.org, which is our website here in the States, that is where you can go to find out where you can get tested and get treated for STIs at our wellness centers. We started using an amazing AI chatbot for when actual humans aren't available to return messages. So, and that's been very successful too, with a lot of engagement and being able to get people to get into to our services and get tested and get treated and become one of our clients. So all of those things said, it's just really trying to attach ourselves to what's happening out there in the world and making sure that we're not falling behind in our messaging.
Yeah, I agree with you when you say just falling off the trend as well, feeding off the trend that we see. I remember when there was like a TikTok thing on we listen and we don't judge, and that was parlayed into like an out of the closet and wellness clinic campaign, ad, more like an advert. So yeah, I like the idea because you mentioned about young people, which is a concern really in terms of new infection rates amongst that demographic. I think of one of the campaigns that came out of AHF, and it was the Not Ready for Parenthood. I like that one because he had the child with the messy pasta and all. Yeah. And things like that. I think we need to find ways where young people, things that resonate with them, that they can relate with and relate to. So when you talk about TikTok and social media, there's a lot in social media, but finding the sweet spot that can get their attention. So it takes a whole village, right? That's what I hear you say, to get to make awareness campaigns stick, to make them fun, to make them relatable, to make them exciting, but also thinking about the audience in mind, keeping them in mind, what would work best for them. I think that's important. Also, working with influencers like we do for some things, or even young people themselves have become voices, who can create a campaign out of anything. to push a message. So thank you for sharing that. I have a question. I know this might be a bit hard, but we'll try and see what we do with it. You both have done different creative stuff. So you've worked on different interventions or creative health campaigns. So let me start with Dr. Sam. Out of all the ones you've done or you've worked on, which is your favorite and why?
I think my favorite, as Jason was rightly saying, is about the population that we need to focus. It's actually the young population from even diverse backgrounds and LGBTQI, both urban and rural also. And in a country like India, where 75% of the young people, the population is young people under 39 years old, and so India is going to be very virile and very sexy. It's we call it as the Youngistan, not the Hindustan, anymore. So it's a young people's society. So we need to have campaigns which can actually attract the attention of people and the youngsters, as we all say, that catch them young. For example, if I may, this is safer is sexy and there is a pen. So youth, they are attracted to the pen, and then there is the free condom store ad also here. I mean, the helpline is here. So when what we do is we encourage the youth to come and take pictures or selfies. They often take selfies. But if they show us and then show us that they are putting on the social media, which is again marketing, again dissemination of the whole program, then we give them a pen, or we give them a keychain, or we give them a phone stick, the finger hold,
For the phones,
prop, phone like that. So that again, multiplies. It's a multiplier effect, as you can see. We are doing an event, we have our own marketing, but then everybody who comes there is attracted or slowly kind of lured into something that they will put it on the social media, show us, and then we give them a pen. It's multiple layers of marketing. So in a day when we did those kind of things, it became very, very popular and viral. So I would say that this is one of the easiest or the most attractive campaign, and that also made a lot of buzz in the adult population. They were saying, "Oh no, where are these people going? Where are these youngsters?" So
what else are you going to pull out of your hat?
Yes. so I think that was the most important or most attractive campaign that we did, Kemi.
Thank you for sharing. Because, something I like that you and Jason have highlighted is that a key part of health marketing or campaign is also making sure that the messaging is not the end. It's the starting point.
Yeah.
But you need to also show them where to go. Should they have questions? Should they need more information? I think that's something that we need to keep reiterating, that it's not just enough to put out the message, but if I have questions, if I need answers, if I need to talk to someone, for example, where do I go to get more of that? So thank you for sharing. Jason, what's your favorite of all the creatives? You've worked on so many, so.
Oh, wow.
Very difficult question.
Yeah, let me go back 20 years of campaigns. No, I'll say, since it was brought up earlier, I guess most recently would be the Just Use It campaign, because this is a perfect, I guess, look at how these campaigns are created and a lot of the controversy that can happen around them as well. Because the idea here was, like I said before, when we do parodies where we take iconic things, in society. So this was an idea where I had to normalize the condom by taking the Nike type. I won't say the actual slogan, but a similar message to what Nike has with the just do it campaign. So this was taking a banana that looked very similar to their swoosh, the trademark, and putting a condom around it, and then just saying, just use it. Just 3 words, very simple, very to the point. But when we tried to put this campaign out, specifically in the States, almost all of the billboard companies, there's 3 large advertising billboard companies that put out these messages. All of them, or none of them, wanted to run the message. All 3 of them, they just said, for their various reasons, they didn't want to run the message. So for us, we were like, well, we're not going to stop there. We have to get this message out. This is something we think is going to be very popular and will, further help with our condom advocacy. So we went around them and we found independent operators here, like specific business owners that own their own billboards, and went directly to them, and they loved it. And it got a ton of attention and social media attention and just all this hype around it. And it just proves that type of censorship really doesn't have a place in society right now, as far as in a time when, like I said, STD rate or STI rates are just skyrocketing. Sexual health is not something that's being discussed as much in schools. You have people that are trying to stop access to condoms. So when you have companies, these billboard companies that will put out ads for much more scandalous things than a condom, tell you they're not going to do it, you have to find a way around it. So that's what we did. And then we saw that when this campaign went global, after that, it was just so great to see how it was usable in so many countries in different languages, and people just got it, because that original campaign we were basing it on is universal. So it's like Coca-Cola or a Pepsi or something. You can find it pretty much anywhere in the world. So Nike's the same way. So we wanted to use that, and we've received awards from that campaign, and it's just beautiful to see it in so many different languages. So that's probably my favorite campaign as of recent times.
Yes, because I can imagine going back 20 years. That's
it's hard to remember it.
For like a day plus.
Right.
But yes, you raise a very important point about censorship, but it's also the need for audacious kind of marketing when it comes to health.
Yes.
So, because health is a matter of life and death, so we can't play around it, and we need to get the message out to the people who need it and who have to have it, so that they can make better choices for their lives. And thank you for sharing that. Just for the Just Use It campaign, Dr. Sam also, his condom mascot is called Just Use It. So
Yes.
that also speaks to the global and ripple effect. Even in a lot of our countries in Africa as well, during the campaign, it caught on. It resonated with people in terms of just use it. It's simple. You don't need to debate it. Protect yourself and your loved ones. It's been such a pleasure having this conversation with the both of you and sharing your insights when it comes to health awareness. And I know, yes, even if a lot of the focus was on condoms, but the same still applies to health campaigns in general, because we need to see more of that. Every day we have to keep educating people. And another thing that I like from what you both have brought out is we need to normalize the conversation, normalize condoms. Condom advocacy is something that should not end. It needs to continue because of the role that it plays. And where we find stigma and taboos, we need to normalize the conversation with not just the target audience, but even the gatekeepers. So like Dr. Sam shared about whether it's political leaders, religious leaders, traditional leaders, we need to be able to also get buy-in as well. So it's important. Great. All right. So I have another segment, which is just, it just still feeds off keeping health sexy and creative. Just wanted to check with you both. And it's a rapid fire this or that. You don't have to think too hard about it. Just call it the Safer is Sexy edition. Of the this or that. And I'm going to start with you, Jason, and I'll take it to Dr. Sam. You both will not answer the same questions, just so we level the playing field. You answer individual questions. Don't think too hard. Just the first thought that comes to your mind works. Are you ready?
All right, let's do it.
Okay, so Jason, billboard campaign or viral TikTok challenge?
A billboard campaign.
Dr. Sam, humor or shock value?
Both.
Nah, you got to choose one.
Okay. Shock value.
Okay, Jason, condom vending machines in clubs or free parks at every campus?
Condom machines.
Okay, Dr. Sam, public health jingles or bold visual storytelling?
Jingles, for sure.
Jingles. So these are two taglines, Jason. Which of them? Safer sex is smart or safer is sexy?
Safer is sexy.
Okay, Dr. Sam, if you had to pick TV ads or influencer collaborations?
Influencer collaboration.
I know it's hard, don't worry. Jason,
Yeah.
Jason, serious awareness campaigns or cheeky funny ones?
Cheeky, funny ones, of course.
Dr. Sam, data-driven strategy or creative instinct?
Creative instinct.
Okay. Jason, so this one is looking at condom packaging. Minimalist, slick, or loud and playful?
Loud and playful.
Okay. And Dr. Sam, would you rather reach 1 million views or spark one real conversation that changes a mind?
Oh, 1,000,000 views for sure.
I thought you were going to say one. I thought you were going to say one real.
Oh, no.
But that's okay. So 1 million views. Okay, that's
Because
fine.
that might,
So,
for me, I thought, that might change many people.
okay, well, especially in this day of viral. Yeah, that's true.
Yeah.
So I'm just going to give the both of you, before I close out this episode, but I've had so much fun. I'm going to give each of you just about 30 seconds just to speak to creative minds out there, especially those working in the health space. What do they need to do to make sure that we don't lose the creative part of health, because it's an equally important part of health? Let's start with you, Dr. Sam, and then I'll end it with Jason.
I think, one has to be very open with the minds as to say that, these are things that are to be done in a fun and approachable manner. Sex is not sin. Sex is fun. So just keep that in mind and then do what you want to do. I think everything will fall in place if you have that.
Thank you, Jason.
I think that's a great way to put it, Dr. Sam. Yeah, and just push the limits. With so much content out there, you got to be a little edgy. You got to be willing to do what you need to do to get your message across, and try to break things every once in a while and break the rules. You don't need to be like everybody else. So it served us very well. So I think as long as we can stay ahead of the trends and still have that shock value, but also show that we're caring and we want to help support people's sexual health, is the number one approach. So that's what I think would be best.
Right.
Thank you so much, Dr. Sam and Jason. I don't have anything to add to what you both have said. I think it's more of a call to action, but it's also one that is very empowering, especially for those who are doing creative marketing within the health space that sometimes people can consider boring, right? So thank you for that, and thank you for joining us. So you've heard it all today. The big takeaway: safer can be sexy and health awareness can be cool. And when campaigns are creative, relatable, bold, edgy, they don't just inform, they change behavior, culture, and lives. So the next time someone says condoms are boring or health is boring, remind them that the real revolution is making safety something everyone wants to be part of, normalizing it, and everyone wants to enjoy. Thanks for listening, and let's keep pushing public health to be not just serious, but seriously engaging and also cool. Bye-bye. Thanks for being part of the global public health revolution. We hope today's conversation left you inspired, challenged, and ready to shake things up. If you loved this episode, don't keep it to yourself. Subscribe, leave us a review, and share it with your network. Let's keep the momentum going.